pleased to be joined by Kendra Schmidt from Deaf Access Services. You'll also hear from Dr. Gail Burstein on some of the issues with regards to COVID as we give an update. First off, I got a haircut this morning. A lot of people are wondering whether I was going to go real short or keep it long, and it is a little longer, so I did get a haircut. You can get haircuts now. You have to get an appointment. You cannot just do walk-in service. I had mine set up through an appointment with a stylist. So if you need to get a haircut, you can get it. You just have to schedule it beforehand. They are not able to provide every service, so waxing and things like that they can't do. But the haircuts are available, and I got one. I like my hair a little longer, so I decided to keep it a little longer, just trimmed it up. Also something that opened today that I stopped by and I picked up a book is the Buffalo and Erie County Public Libraries. Many of the libraries are now open again. I was down at the Central Library today. It was great to be inside the library again. I picked up this book by Robert Reich, The Common Good. It is your book. It is not my book. It is a book of the people that I'm borrowing for a few weeks to read. And you now have an opportunity to get back into the libraries, but not every library is open the same hours as they were before. So I ask that you all check with your local library. Go online to the Buffalo and Erie County Library's website, its Facebook page, and you'll find out more information on the library hours, which branches are open, which are not. So please make sure you get out there and enjoy your libraries in person. I know many of you have been taking books out, ebooks, and then recently they had curbside pickup. But now you can actually walk in and you can browse the selection of books and other media. And that's a good thing, because I think we all really want to feel like we're getting back to normal after a number of months of COVID and truthfully what we were dealing with in the last week or so with regards to protests. It's been a very tumultuous time in our country and of course in our own community after the incidents we saw last Thursday. We actually have a gentleman who was instrumental in that, Mike Desmond here from WBFO, who had the main recording that I think has gone, almost seems like everybody in the world has seen. And we do have to address the issues with regards to racial injustice and police brutality, and we are going to do that locally. There's no doubt about it. There's lots of folks that are out there that are doing it, and I think it's something that we all realize we have to do, but we're also going to be reopening our community as well, and that's why it's important that we ensure that we continue to move forward with the progress that we've done, and the information you'll see very soon shows that that progress continues. As usual, little provisos. This is the presentation that's on the screen, and you'll be seeing at home if you're watching on our Facebook or YouTube page, is the information that is as done, or as it was provided to us as of this morning. It may have changed, often does, and so as usual, a little proviso there. But as of June 7th, last night evening, there were 6,458 confirmed total positive cases of COVID-19 since the outbreak began. Over 77,000 specimens have been taken, tested. Those are individuals who have been tested. 560 people had died. This was through Friday, at least. We do not usually get the update for Monday until later in Monday afternoon. So this number has been the same for the last few days. I do anticipate there to be an increase. We do know that there were at least a couple individuals that died in hospital based on reports that we received through Saturday. So we expect that number to go up. On June 6th, there were 103 individuals admitted to Erie County hospitals for COVID-19. This is the lowest amount we've had since the end of March. So we continue to head downward, and this is nice because this is approximately 2 weeks after Memorial Day weekend. So we're not seeing this big spike as a result of Memorial Day weekend with regards to COVID-19 hospitalizations as well as cases. 32 individuals were in the ICU, 17 individuals had an airway assist or an intubation. Here's the numbers for Western New York. You see the continual downward trend. That's a very important thing we're very happy about. Hospitalization data, and here's the numbers once again with regards to Erie County in general. You see the continued drop with regards to hospitalizations, and you see the ICUs and ICU airway assists have stayed pretty static. So those numbers have not changed, and we believe some of those individuals have been in hospital for quite some time now. They're generally not newer patients. They've been there, some of them, since March. They're still hanging on. So we want those individuals to get through this as quickly as possible, and some of them, unfortunately, have been there for a while. You really notice the difference in the drop with regards to the hospitalization data. As you see the numbers going down, this is dating back to end of March, and you can see it's the lowest numbers we've had since the end of March with hospitalizations, and you really do see that static line with regards to ICU airway assists and ICU patients and how they just have stayed pretty flat for the last 10 days or so. Cases, By age and gender, this number, well, the numbers will change, but the bars have been pretty static for a while now, and that pretty much every age group over the age of 20 has people that are not hospitalized, excuse me, have confirmed cases of COVID, and you see that number as it goes by each age range. And I think it's important to note, as we've been saying all along, it doesn't really matter what age you are, you can catch COVID-19. Even now, there are still new cases of individuals in our community that are contracting COVID-19. It's just at a lower rate than what we saw beforehand. So it's not as if no one's catching it. There are new people catching it. And then the total numbers as of last night for each age category, you can see it right there, 6,458 total cases, and broken down that the age ranges of those who've had it are as young as under the age of 1, and we know of individuals that were in their 90s that had it. So that doesn't really matter what age you are, you can end up contracting COVID-19. And then the residents, excuse me, and gender, you note that females have tested much more positive than males. 56.5% female tested positive compared to 43.5% male. I don't know exactly why, but I can note that for the record, there are more females in Erie County than males. It's about 51-49. I don't have the rationale why. Maybe Dr. Burstein can talk a little bit about that. But residents, this is also something that we've been keeping track of, is the percentage of cases, and we'll talk a little bit about the mortality issues. But for those that have caught COVID-19, there's a greater percentage of individuals that live in the city of Buffalo who've had it than should, based on the population of Erie County. 45% of all cases have been city residents, and the population of Erie County is only about 28% for the city of Buffalo. But this number is different when it comes to mortality data, is it's actually lower than what you would expect for the city of Buffalo. Diagnostic tests. This is important. This is the PCR swab test. They put the swab up your nose, and as you can see, the trend line continues to drop. So last week, and this is important, they did the most tests ever in a week, and it has the lowest percentage of positive cases. It's actually below 3% now for just last week alone. So COVID-19 is still out in the community. It's just not being contracted at the same rates as it was earlier. Now, we're testing more of the general public at this time. And we're also testing some of the, a lot of repeat individuals. But new cases are not coming in at the same amount as they were beforehand, not only with regards to the percentage of the overall cases that were tested that week, but also just in positives in general. Earlier, a couple months ago, it wasn't surprising if we tested 500 people in a day that 150 to 200 of them were testing positive. Now we're testing thousands in a day, and it's 50 to 70 that are testing positive. So the number of individuals that are contracting COVID-19 as new cases are actually going down. In antibody testing, we're seeing a reduction in the positives with regards to antibody testing too. 8,000 or more than 8,000 were tested last week, and only 397 tested positive for a rate of 4.8%. We're still hanging around 7% in total for every individual who's been tested for antibody test to test positive for antibodies. So it's something that I think we need to consider, is that there's still less than 10% of our population that is tested positive for it, which means more than 90% could still theoretically contract it. It's still out there. That's why you got to follow good social distancing guidelines, wear your masks and things like that, so that we are prepared for additional cases in the future. But the vast majority of people, over 90% of the people in Erie County, have not contracted the coronavirus based on our antibody testing numbers. Mortality data, very similar graphs that you've seen, except the numbers have increased. The vast majority of the people who deceased as a result of COVID-19 in Erie County are over the ages of 70. There are individuals starting in the age group of 30 to 39 who have perished as a result of COVID-19, but what we're seeing is that it's still that those over the age of 70 and really those over the age of 80 are most at risk for dying from COVID-19 in our community, which is no different than what was originally said when this outbreak started in the United States. When they were talking about what happened in China and South Korea and Italy, it was really affecting those that were elderly more than others. And this is the chart I talked about a little earlier, that of the fatalities, the city of Buffalo is 27.9% of the residents of Erie County, but of fatalities, they've only come up with 24.3%. So that's a good thing compared to other communities where we've seen fatalities like New York City, Chicago, Boston, where more than 50% of all those who died have been African Americans. So we've done a better job by working with many partners, including hospitals, nursing homes, but also our friends with the African American Health Disparities Task Force, to get resources into the city to identify cases early so that individuals get the services they need and they don't wait until it's too late. So that's a very important number, and there's a lot of parties that have played a role in it. And I think it says a lot about our community, because if you talk to, and I've talked to other colleagues of mine, if you talk to your colleagues in media, to those in other parts of the Northeast especially, in California, you've seen high percentages of African Americans dying as a percentage of their population as a result of COVID-19, and we have not seen that here. We saw it early, but it's been dropping, and I think that's important with regards to both percentage of where they live, and then here's the percentages with regards to race and ethnicity. And the population of African Americans in Erie County is 14.6%, and African Americans are making up 15.9% of the deaths. So as a city, in what we're dealing with in the city, and whether it's white or black, as well as issues associated with just straight up race, we've done better than a lot of other parts of the country, and that continues. Erie County Responds, I'm going to turn it over to Dr. Burstein so she can talk a little bit about the issues associated with our new line. And we've got our special little spray here, so I'm going to pull out the step for the doc. Oops. And I'm going to spray the keyboard. There you go, Doc.
Thank you.
I'm going to put my mask back on. All yours.
Thank you. So, good afternoon. So first I want to talk about our Erie County COVID-19 information line. So we have new hours of operation. The requests for information have not been intense, especially as on the weekends. So we cut our hours to Monday through Saturday from 9 a.m. to 5 p.m. The new hours started this past Saturday, and we still are answering a lot of questions throughout the normal week. So far, we have answered over 47,000 calls since we opened up in the beginning of March. So now I want to talk to you about harm reduction. And we know that businesses are opening up, people are able to eat or drink outside in restaurants, people are able to go shopping, people are out. So given that people are out, the question is, how can we reduce our risk of exposure and infection when we're going out? And the answer is face masks. Face masks are very, very, very powerful harm reduction tools that we can all use to reduce our risk of getting infected with COVID-19 when we are out. And one of the ways we know this is from actually looking at our own hospital data. Dr. Peter Winkelstein, who is a professor of pediatrics and the executive director of the Institute for Healthcare Informatics at the Jacobs School of Medicine, has assembled this analytics team that has looked at our data and used that to model what our hospital admissions would look like depending on the proportion of people in our community that are wearing masks. So this is a graph of looking at the data, and I know it's a little bit busy, and I will walk you through it so everybody will understand it. So this is looking at the model of what the hospital census will be depending on the proportion of people that wear masks. So along the x-axis are the dates starting from March and then projecting all out until September. And then along the y-axis are the hospital census, so the number of people that are admitted to the hospital. The yellow line is what we will expect for our hospital admissions depending on the proportion of people that are wearing masks when they're out. And then the vertical lines correspond to the different milestones in our New York pause that mandated people being contained, and then is also allowing us to reopen. So starting off in March with school closures, and then businesses closures, and then in April, the governor has recommended face masks when people are out. Then in May, we had a reopening with phase 1 of businesses, and then in the beginning of June, we had phase 2 businesses opening. The yellow lines correspond to, again, what we would expect our hospital admissions would be, depending on the proportion of people that wear face masks. And then the blue dots correspond to the actual hospital census data that we have. So you can see very obviously if only 25% of people in our community wear face masks when they go out, we're going to have a much higher hospital census, and that's because we're going to have a lot more people in our community who are contracting COVID-19 and becoming very, very ill. Whereas if 75% of the community wear masks when they go out, our hospital census will stay very, very low, and that's because very few people in the community will be infected with COVID-19. So again, wearing masks, it's very, very important. That is a key to keeping these numbers down in our community as Erie County opens. So I just want to picture about wearing a mask. And the reason why it's so important to wear a mask, even for people that don't have any symptoms for COVID-19. So we know that even when we talk, we spew out droplets from our mouth that can go as far as 6 feet and even beyond, depending on the air circulation. So we also know, especially now that we're testing thousands of people every day, that many people who are infected with COVID-19 have no idea. They don't have any symptoms at all. People are getting tested because of their employment. People are getting tested because they're contacts that are otherwise healthy, or people getting tested because they have elective surgery scheduled. And so we're finding a lot of people that don't have any symptoms. So it's really important for everybody to wear a mask in case they could be infected and don't know it, to protect people around you from your droplets and contagious virus, spewing out and infecting other people. Also, we know that masks do have a protective effect for us who are not infected from getting exposed, especially if it covers your mouth and your nose. That's really important. And also in conjunction with physical distancing. Those are all really important, but wearing a mask is so important. And then for people who want to get tested for COVID-19, we're offering diagnostic testing, so that will tell you at that point in time when you have the specimen collected, do you have an active infection with the COVID-19 virus? So you can call 716-858-2929. There is foreign language translation available, so language is not a barrier to getting tested. So this is for anybody who believes they may have been exposed. So that means that people that were out protesting over the past few days, if they think that they could have been exposed, we are able to test you. You don't need a lab order or any type of doctor's referral. It's by appointment only. And clinics are available throughout Erie County, including sites in the clinic. So, and please, if you have an appointment scheduled, please show up, because there are a lot of people that want to get tested, and then you're taking up somebody else's spot. So again, if you feel sick, if you feel you've been exposed, if you're at a demonstration this past weekend, we recommend that you can get tested. Just if you don't have any symptoms and you think you may have been exposed, we recommend getting tested like about 5 days out or more after the time that you think have been exposed. Because remember, it takes a few days for the viral load, the virus to replicate, to get high enough so that we'll be able to detect it. So we want to make sure that when you do come and get tested, that we will be able to get find the virus, and we won't have a false negative. So again, if you think you were out protesting on Sunday and you could have been exposed, come to our clinic on Thursday, and that'll be a good time to get tested, because your virus levels, if you are infected, will hopefully be high enough that we can detect it. So, speaking of which, we have some new Erie County site that we're offering testing actually in the city of Buffalo. It's at Kensington High School on 319 Suffolk Street in Buffalo in the 14215 district. So we're going to be there on Thursdays between 10 a.m. and 2 p.m. Again, appointments are greatly appreciated. We really want to make sure there's good social distancing, so we have you at a certain time that is scheduled. You won't be, a whole bunch of people won't be crowded up in line. You don't need a prescription or a doctor's order. There's no cost. We'll take drive-throughs or walk-ins. So people don't have a car, that is not a barrier to get tested. And we're especially focusing in this area because we know that Kaleida has had to close up their community testing sites, which included 2 in the city, one at the Leroy Close Library and the other on Best and Main Streets. So we're helping to fill that gap for help individuals get tested in the city. And again, we thank the Buffalo Public Schools for allowing us to use their school. And then if you don't think you live near that site, or you want to figure out where's the best place for you to get tested for a diagnostic test or an antibody test, you can go to our interactive map at www.erie.gov/COVID test sites. And so this is an interactive map. This is a map of Erie County, and you click on one of the purple stars, and it will see a pop-up window listing the type of testing done, the hours of operation, whether they take insurance or not, and whether you need a physician's order or not. So all the details are in there. And also, when pharmacies come on board, if they notify us that they're testing, we are including those pharmacies. So we're trying to be as comprehensive as possible. We're also doing antibody testing now. We are scheduling for the month of June. Again, we need people to make an appointment at 858-2929. You don't need any type of physician's order or referral. So this is a phlebotomy, so we are going to have to stick a needle in your arm and draw the blood, but our phlebotomists are super skilled, and you should be in and out in 5 minutes. So we're rotating clinic sites, throughout the county, so at the end of a month, we will have been in a spot near you. So call our appointment line and find out when we're scheduled near you. I just want to point out, again, we want to make sure that each week we have a testing site in the city of Buffalo. This week it is going to be on Saturday at Bennett High School. So again, we want to make sure that that everybody, I know that the date is
Thursday or Saturday?
I thought that it's a Saturday for the antibody testing and Thursday for the diagnostic testing, but we will clarify that. I'm pretty sure that it's Saturday at Bennett High School. So I'm going to turn it over to our county executive for New York Forward, and I too will spritz the laptop, their computer.
Thank you, Dr. Burstein. Phase 1, phase 2, we're there. Yay! Got my hair cut. And most of the sites that are phase 1 and phase 2 have been open for some time. Retail establishments are now opening. Some of them took a few days. Barbers, stylists took a few days. They wanted to make certain they were doing everything properly. If you are one of the industries in phase 1 and phase 2, you have to file an affirmation with New York State. You have to have your plan. If you do, you have your plan in place. It's got to be available for other people to see, as well as filing your affirmation with New York State. You can open. Big announcement today by Governor Cuomo is that places of worship will be permitted to reopen with 25% occupancy. That is important because there's a lot of very large places of worship. I grew up at Our Lady of Victory in Lackawanna, and that church can hold over 1,000. So this is something I think is very important, especially as people are talking about weddings, events like that, christenings, other types of important events in places of worship, that now you can actually bring more people in. Those with a chronic health condition or people with someone in their household that would be vulnerable to complications should consider attending virtually. But the governor did announce that all places of worship are now permitted to open at 25% capacity. Contact tracing, we continue to do contact tracing. So I want people to know that we've been doing contact tracing every day since this started. There's a lot of folks who are saying, oh, you stopped doing contact tracing. That is not the case. We've been contact tracing everyone since day one. We haven't announced where everyone has gone since a while, but if you were in close contact with an individual during a time period in which they appear to have had COVID-19, you would have been getting a call from our Department of Health saying you need to be tested because someone that you knew were in close contact with during that period is tested positive. And that's why we continue to do contact tracing, and we have lots of contact tracers doing that work, and we'll continue until basically the last case is done. I want to thank the diagnostic test site personnel who've been working very hard. If you show up at one of the sites, most of them are drive-through for the county. They're actually all drive-through for the county. There's some other locations that might not be drive-through, like pharmacies and things like that, but you'll see individuals like this on the screen that you're watching, looking like they're in full decontamination suit units, because we want to protect all those individuals. And thankfully, all the people who've been working since day one testing individuals in Erie County, none of them have tested positive because of the good work that we've done to ensure that they're wearing appropriate personal protective equipment, PPE. So when you drive in, you'll look at these people dressed like this, and I just want to thank them for the good work that they've been doing, because they've been working very hard for the last 3.5 to 4 months. Once again, phase 2 is here. If things continue to go well, and the numbers have been trending very well, since we entered phase 2, we could potentially enter phase 3 next week. And then that is the reopening of bars and restaurants at a limited capacity. Yesterday afternoon, I actually had dinner, or late lunch, early dinner on the patio of the Terrace Restaurant in Delaware Park, and it just felt good. It just felt really good to be able to sit down, have someone serve you in one of the best places in all of Western New York. So please get out there, take advantage of the local restaurants that have outdoor seating, and hopefully in a week you'll be able to go into indoor restaurants and actually seat indoor, and then help continue to rebuild our economy. We are headed in the right direction. We're very happy with what we're seeing with regards to the hospitalization numbers, as well as the numbers associated with new cases. New cases that we're testing as a percentage are going down. We are seeing in other parts of the country where the numbers are really starting to skyrocket, in areas where they just opened up everything at once. So it just goes to show, as Dr. Burstein said, wear your mask in public. It actually cuts down on the transmission. Yesterday, a lot of people know I participated in the march from City Hall to Bidwell Parkway, and everyone I saw was wearing masks. And I think that's important. We've been saying all along, if you cannot safely socially distant, wear your mask. It's going to be your #1 protector. People weren't shaking hands, high fives, they were giving little elbow bumps, things like that. So everyone was following appropriate protocols. And if we continue, I think very soon we'll have the vast majority of businesses open, and we will, if not be back to normal, it'll feel much more normal than it has, at least since early March. And I think we are all ready for that. With that, I'll open up to questions. Mike Baggerman from WBEN.
Mark, given, you talk about reopening, but given the data showing that the last 2 weeks, more than 2 weeks actually, since Memorial Day, the hospitalization numbers continue to go down. You had the Memorial Day gatherings, protesting that's been the past couple of weeks. Don't you think we can start to reopen a little quicker? Is that something you think you could advocate for?
Well, the question was, can we reopen a little quicker based on the numbers that we've been seeing? And at 4 o'clock today, I'll be on a control room call with the Western New York group, including representatives from the governor's office. We'll be sharing the latest data with them. They have a lot of the data. They are sticking to their 2-week guideline. But you do see changes every now and then. Like last week, the governor talked about outdoor dining is available for restaurants. And today he announced that places of worship can go up to 200 or 25% of their capacity. So we are advocating by showing the numbers and the good things, but they've pretty much wanted to stick to this 2-week guideline.
So are there some things then that this control board would be advocating for that would be in phase 3? I mean, we've already seen that outdoor patios can open up. Are there other things that you think can open up before technically we reach that phase?
The question was, are there other things that can open up before we reach phase 3, and I assume phase 4 you're talking? I don't know. I'm not the specialist in this area. They've been relying on specialists from the University of London, NYU, other institutions, including the University of Buffalo. So I think what they're trying to do is avoid what's being done in the other states, which is they just sort of reopened, and now they're seeing their numbers go up. And the nice thing is it's not just in Western New York where the numbers are going down. It's all over the entire state. You're seeing it in New York City. You're seeing it in Long Island. So I think that's not a mistake. I think it's because what you're seeing is they have a program that it was recommended by the healthcare professionals and the public health professionals, and it seems to be working, which is slow the contraction. We know people are still going to contract it. We don't know what the summer months will bring. We're seeing some of the biggest spikes in some of the hottest communities like Arizona or Tennessee. They're seeing those are a lot hotter than us. So the argument that it gets hotter out, it'll kill the virus, I don't think that's necessarily working. But they have a plan. They're sticking to it. There's legitimacy to that plan, and I think it shows it's legitimate, and it makes sense because we just have had declining numbers with regards to contraction and hospitalizations, and we all should be happy for that. Mike Desmond?
Mark, I asked you a couple of weeks ago about group homes, and in fact, when
Mhm.
you didn't have any data. The story in the Buffalo News today suggests that the state has been suppressing data about infections and deaths among group home patients and group home staff. Do you have any idea if any of them have occurred in Erie County and the state just isn't telling you?
I don't know the answer to that question. We actually get reports on a daily basis of COVID-19 hospitalizations, individuals in nursing homes, and individuals in adult care facilities. But we do not get the group home information. So what I just have to say is, I'll talk, we actually were, some of us were talking about it this morning. The only way we'd be able to do that is to go back through the records of who tested positive, because we have their addresses. So we can sort of cross-reference by looking at their addresses and compare that to the group home addresses that we're aware of. We have no role whatsoever in the group homes, developmentally disabled and the like. So it's all state. But we can take a look at it, and we're going to. I saw the report this morning, and it would, I don't want to say the report was surprising, because anywhere where there's a group facility, you have a greater risk of transmission right from day one. We always knew that. What we've been told by New York State is, no, we don't see any outbreaks like you see in other locations. But it's quite apparent from today's Buffalo News article that there are individuals who are catching it in group homes, and unfortunately individuals who are dying. You and then Mike and David. She had her hand up first, David. Yes.
What does reopening look like for Erie County employees? Is there a long-term plan to bring back those who have been teleworking?
The question was, is there a plan to bring back Erie County employees who have been teleworking? And the answer is yes, and some of them started coming back today. Today is the first day in which we were bringing back individuals who have been working at home through the whole period. We actually, 3 weeks ago, I communicated with our team, our commissioners and department heads, and say, you need to implement a reopening plan. You have to follow the CDC, the state and county guidelines, and we have done that. And what we're doing now is bringing back people following with that plan at limited capacity. We just didn't go straight to 100% capacity. So there are departments that have had almost no one here since the beginning of the outbreak, and they're starting to bring folks back. And we're doing it in the manner as recommended by the CDC, the state, and for that matter, the county health department. So that is happening.
We know the city of Buffalo has said workers who are working from home may permanently be working from home. Is that something for the county?
Everything's going to be visited on basically a job-by-job basis. We're not going to say everyone who's been working home is going to permanently work home. Some of the individuals who've been working at home really need to be in the office to really get the most efficiency out of them with regards to the resources that are available. For example, I'll give you an example, Department of Environment and Planning. You can get a lot of things that we have online in our Department of Environment and Planning, but if you need to define something with regards to a sewage drainage map, it may not be online, and the only thing is we got a giant map room in the Department of Environment and Planning, and you have to go through the map room and look through every town, every village, find the code number and get the right one. So there are certain things that, because of the services that are provided, we're just going to have people in the office. But we will consider some positions potentially being working at home only, but it's just different. Remember, we serve the public. We have to be able to ensure that the individuals are not defrauding the public by saying they're working, doing limited work, charging for 8 hours a day, but only doing 3-4 hours of work. And we can figure that out in county government when they're in the building by everybody has to swipe in when you come in, swipe out for lunch, swipe back in after lunch, swipe when you go home. That doesn't happen when you're working at home. So there's certain things that we have to ensure that we're protecting as well, while still providing the services to the public. David.
What was your reaction on Saturday to seeing supporters of the two Buffalo police officers gathered outside the city court?
The question was, what was my reaction to those that were gathered outside city court, the supporters of the two police officers, many without masks? It was a protest. It was a peaceful protest, is what it was. I wish they had masks on. From the people who were protesting yesterday and day before and they had the masks on versus those that didn't, the individuals on Saturday who protested in favor of the, or had a, I don't know if you call it a protest, whatever, but it was similar to a protest They shut down the street. But I wish they had masks on because they probably are much more higher at risk for spreading COVID-19 than others. And we know early on there was an outbreak in the city of Buffalo's police department. There was an outbreak in the city of Buffalo fire department. So it's not like first responders aren't at risk. Police officers and first responders are at risk probably more than others. So I don't have any objection to them protesting, like I don't have other objections to people protesting. And truthfully, even when we had the people that were protesting to reopen Erie County,
You call them ding-dong.
no, I called one person a ding-dong.
Okay.
I had no problem. He said they call them ding-dongs. I called one person a ding-dong. I had no problem with the people protesting. I had a problem with the ding-dong that was driving the vehicle with the Confederate flag. I called them a ding-dong because that was the nicest words I could use at that point. What they were was racist. You do not drive around with the Confederate battle flag unless you're trying to send a message. It is not about states' rights. It's about subjugation of people of color. So if you go through, if you just, let me finish, David, and you go through my tweets, you'll notice in those, about those protests, I never said the protesters were ding-dongs. I just said the protest's going on, it's peaceful, there's about a couple 150 people out, but there's one ding-dong driving around Niagara Square with the Confederate battle flag and the American flag right next to it. And maybe someone needs to talk to the individual about their American history. But the last time I checked, the people who were fighting with the Confederate battle flag were traitors to this nation, members of the Confederate States of America who wanted to divide this nation and continue slavery. So he's got, or she, I don't know, may have been a male, may have been a female, I don't really know, had the American flag on one side of the truck and the Confederate flag on the other. You cannot be a good United States citizen and have both flags on your truck because you are saying to other people, I support the rebels who would have kept people enslavement in the South. That's what it stands for. It's not about states' rights. It is solely about subjugation of people of color. That person, and the kindest words I could use, was a ding-dong. Can I get a follow-up, David?
Just to be clear, you never said anything about they shouldn't be out there protesting, even though they stayed in their cars back then. And it must
I mean, I did not. I did not say anything about those individuals. And there were people that actually protested in the square, and then there were people that protested in front of the Rath building. And a lot of people were calling for me to come out, and none of them had their masks. Well, I shouldn't say that. Some had masks on. Some did have masks on. And some had masks on.
Some do, some don't.
Yeah.
You,
And actually, I was outside standing.
Commissioner, though, Fringe, when you see, and when the demonstrations began, we were still, I think, under the number of 10 people gathered.
Yes.
And you see hundreds gathered together, ignoring all that, and they get Fringe and all that.
Well,
We're gonna have a problem. Because at the same time, you were
We had-
passionately defending their right to protest.
And here's what it is. We live in a society that is certain freedoms that are guaranteed by the Constitution. I had this conversation last week about the issues with regards to implementing a curfew and how I was torn and how I pulled off the curfew a lot sooner than was done in the city of Buffalo. Because you use the curfew only when you need to protect against individuals and to protect against the damage that we were seeing from the looting last Saturday or what happened the following Monday where Trooper Ensminger was struck and two others and he was run over. So it's the same thing with regards to the standards. We always said, if you're going to go out in public and you can't stay socially distant, wear a mask. So yeah, I cringe when I see groups. I've driven around our county parks to check on things and I'll see a group of individuals and none of them have masks on, and you can see there's 15 individuals there and there's 15 cars in the parking lot. So I always, when you're in public and you cannot safely socially distant from others, we ask for people to wear masks. And even in the first protest downtown by those who wanted to reopen the community, some of them had masks on. The protest in front of the Rath building, some of them had masks on, and it was getting to that point. People were saying, why won't you come out polling cards? I was. I had a hat on, I had my mask on, nobody recognized me.
You were incognito.
I was wearing my mask, which I'm supposed to, not incognito. Are there any other questions?
Mark,
Michael.
Question for Dr. Burstein.
Okay.
you were talking about the people who are still getting infected. Are you seeing, or from the data you're getting from the hospitals, that after 3 months of this, people who become sick don't say, it really isn't this? They actually come in now or call their doctor? Are they just coming forward a little earlier in the progress of their case?
We're actually surprised we're seeing now that there's more kind of widespread testing in the community. Many people who don't have any symptoms at all, they're being tested because of their employment situation. You know, most recently, people that work in barbershops and hair salons have to get tested every 2 weeks. We're seeing it in people who are scheduled for elective surgeries or elective procedures. They have to have a COVID-19 test that's documented as negative within 72 hours before their procedure, and we're finding people who tested for those reasons that are positives and didn't have any symptoms. So I think it's a combination of testing has been more normalized, and more everybody probably knows somebody who's been tested at least once, and so a combination of that, and then more people being tested just because of other reasons, employment or being scheduled for an elective procedure, or just being worried that they could have been exposed because they're interacting with the people in the community. Those individuals are getting tested, and we're seeing a lot more asymptomatic people. And the CDC reports that they believe now at least a third of individuals don't have any symptoms. So I think we're seeing that now in our community, and maybe even more.
In terms of the people in March that started working in this building today, what's the CDC? I mean, you're checking their temperature, or what are you doing?
So what is our screening criteria for people entering the building? So we are asking by self-report about history of illness and history of contact. Again, since a third of people that are infected with COVID-19 don't have any fever, don't have any symptoms, it would be really bogged down to take everybody's temperature, and we would miss a lot of people, and I think render a false sense of security. So we're asking people to self-monitor before they come in, if they've been sick now or in the past couple days, if they've been in contact with anybody with COVID-19 in the past 14 days, and if they have any reason that otherwise that they think they could have been exposed. So again, that's how we're screening individuals who are coming in who are employees and visitors from the outside. Sure.
To follow up on the question, which is how we're keeping and protecting our employees, we're also following the guidelines. We've separated workstations. So individuals that were separated by 6 feet or greater, that hasn't changed. But if there were back-to-back desks and things like that, that has changed. Everyone is required to wear a mask when they're in this building, when they're traversing or they're outside of their own offices. If there are shared workstations, those are cleaned. And we ask the people, we're giving them the little things too to ensure that they're cleaning them. So we're not cleaning every workstation if only one person is using it in their office, but every night there's a tremendous cleaning that goes on. There's individuals who come in here with the antiviral sprays, and they spray every doorknob, which is a lot. There's a lot of doorknobs in the Rath building. You don't think about how many doors there are until you have to have individuals come and spray every one, so that they ensure that if it was touched during the day, it has the antiviral spray that's recommended by the CDC. So there's so much that we've been doing, and it's also the same stuff that businesses now have to do, which is follow the rules so that we're protecting our employees as best as they can as they come in. I was over at the library today. I was talking to Mary Jean Jakubowski, the director. They're following the same standards. They had some employees that were like, well, is it safe to come in? And the answer, you're just bringing these employees back for the first time. And what I want to remind everybody is, we've had employees in this building every day since March. Our health department, our emergency services department, my office, social services, there's other departments, Department of Public Works. We've had employees here every day, and we've been following those protocols since day one. Same thing in other departments. We're trying to make them as safe as possible. Can individuals catch COVID-19? Sure, because they could catch it from outside in the public. So we have to ensure that we make them as safe as possible. Any other questions?
The UV
Michael?
modeling graph that was shown, Dr. Sand, it's more of a question for you. It showed us wearing the mask through September. Should people assume then that maybe come October, they won't need the masks anymore?
So the question is, how long should we wear the mask? Because Dr. Winkelstein's modeling went through September. Again, it was just a projection through September. Look at it as a weather forecast. So again, the numbers on the graph aren't really for accuracy of the exact numbers that would be admitted to the hospital, but it's just a long-term projection of overall what we can expect to see depending on the proportion of people in the community who wear masks. So you can see that in the model that when only 25% of people adhered to wearing masks in the community, we had a high number of hospital admissions, and when 75% of people adhered to wearing masks, we had very few hospital admissions. So again, that was just a projection through September, and and Dr. Winkelstein is updating that model along and pushing forward. But I think it was just projecting for the near future when schools open up. Because we're hoping when schools open up, I mean, we know that some colleges are opening up, what we could expect to see, and just emphasizing that masks are so important in that equation.
Any guesses then when the CDC will say we don't need these anymore?
I cannot guess what the CDC will say. Well, maybe when COVID-19 is a vaccine-preventable disease.
Thank you, Doctor. I'd like to thank Kendra Schmidt from Deaf Access Service again for once again providing the American Sign Language. As I said earlier, it is our intention to go to one briefing on COVID-19 a week, starting next week, which will be Wednesdays. It will not be Mondays because we don't have the most accurate death and mortality data for over the weekend, and we generally don't get that until around 5 o'clock today. So it makes sense to not have the briefing until we have the most accurate data. Then it's updated on a daily basis, but the weekends are always strange. We just don't get accurate data. And so we want to make certain we give accurate data. So our plan is to do one a week going forward. We will expand it if need be. If there are reasons that we believe that we're headed in the wrong direction, or we see things that we need to get out in the public's eye, we will be expanding the COVID-19 press briefings. But for now, it is our intention to have this briefing this week and then not have another briefing for COVID-19 until next Wednesday. However, there'll be other press conferences as time goes by, and now that you've come and seen our new press room and what we have and the ability to share that information out to the public, we will be having additional press conferences on all kinds of subject matter as we get more back to normal. But when it comes to COVID-19, we'll be doing one a week and add to that as needed if the situation changes. But right now, we're happy about where we are. We're headed in the right direction with both cases, as well as new cases, I should say, as well as hospitalization data. We've had 560 people that have died in Erie County as a result of COVID-19 since basically mid-March. And I know a few people who've lost loved ones. I've had to send some condolence cards and talk to a few people who've lost a loved one. This is real. It's getting better, but to each and every one of those who lost a loved one as a result of COVID-19, once again, you have my deepest condolences, and may we all hope that we never have to go through what any of those families did. Take care, everyone. Be safe and well.